presenter for today's seminar. Again, really thrilled to have Danielle here today. Danielle is an assistant professor in the Department of Psychiatry at UC San Diego. She's also a scientific investigator with the Child and Adolescent Services Research Center, or CASRIC as we call it, and a faculty director of research and evaluation in the UCSD Health Sciences Office of Faculty Affairs. And interestingly, Danielle is a sociologist by training. You can see this perspective in much of her work. Danielle really prioritizes community engaged research. So her research is typically characterized by collaborative work and emphasizes the value of community experience in research processes and for enhancing social service response for historically under-resourced communities. I'll say personally, I've had the pleasure of working with Danielle now for a few years. I am always inspired just by witnessing her partnership with the community agencies that she works with, consistently impressed by the quality of her work and again, the partnerships that she's nurtured with her partners over the years. So very thrilled to have Danielle present today. I'll pass it on to you, Danielle.
Awesome. Thanks, Marissa, and for that very kind introduction. It's great to see everybody this afternoon, at least afternoon in Southern California on the dreary day. So thanks for being here with us. I'm going to share my screen and then we'll head into it. Here we go. And then I'm going to make sure I can see all of you on my other screen if everything goes well. There's the title of today's talk. I built this slide deck in between snowboarding and curling events in the last few days. So if I stumble through, you can blame the Olympics and the weird timing of that. Otherwise, hopefully we'll be good to go. So a few acknowledgments to start us off. The work that I'm going to talk about today was funded by the National Institute of Mental Health, the InStep Center grant. The MPIs are Dr. Lauren Brookman-Frazee and Dr. Greg Ahrens, who are here. This is one of the R34s, one of the pilot studies that's part of that center. And I had an amazing team on this call, and if they're not on the call, in other spaces who have really made this work happen. So Marissa being one of those. I see Joel and Paige and Anna, and I'm not sure if Liliana's here, but a great team of people that I get to present the findings for this awesome work that everybody made happen. Also in collaboration with our primary community partner, which is the County of San Diego Child and Family Wellbeing Department. I did invite them to be here, but they had a conflict today. So they have heard, they know these results. They've been an amazing collaborator for years with me. And I say often, you think about champions and you think about a service system that, it's a human service system with a lot of structural challenges, but they're really willing to innovate. They're willing to partner. They're really willing to do good work and affect change for families. So super appreciative to have that collaboration. And then also to our families, youth, and community partners, some of whom are also here as well, who participated in this work, who shared their perspectives with us, who really gave us some great insight and learnings and invited us to their spaces. So thank you to all of them for sharing with us. So, really thinking about I'm super excited about the diverse audience that's here as well. So the plan for today is I'm going to tee this up with some thought questions, and then I'm going to overview the R34 pilot study, work through our findings, and then back to some of the bigger thought questions and discussion. I am going to say I will encourage questions and or discussion throughout so that I'm not just talking for 50 minutes. So I invite that at any point, and you can use the chat. You can just use your little Zoom person self and be here in the space. And Marissa, maybe you can help me monitor if I miss something. Awesome, or Anna. Okay, so as I was thinking about this and sharing this back and sharing in this space today, I put out here what I'm calling my personal existential implementation science musings at the moment as we think about going into this work. Um, so one of the things that I really want us to think about, and it's going to be, this is pre-sharing a little bit. Actually, I was going to ask people too, maybe if you don't mind in the chat. Um, on a scale of one, like I have no idea what a child and family team meeting is, to a 10, like, yeah, I totally know what a CFT is. You don't even have to tell me anything. If you're comfortable just like rating yourself in the chat. But, I realize that's a public space, so no pressure if you don't want to. No peer pressure. I'm just kind of curious where the scale might be in terms of how a familiarity with a CFT. So child and family team meetings, I'm going to talk about what they are more in just a minute, but having us think about as I share the findings, how to move CFT meetings from a system requirement, which is what they are, but to a truly collaborative, empowering, and community-owned process that strengthens family capacity, builds trust, and creates meaningful and lasting plans for child and family well-being, which is their intent. Um, so thinking about that from the beginning. Also, as I teed up in the description for this, the thinking about the need for co-design in this space, really centering the experiences and voices of families and communities being essential, right? It's not just important when we think about doing this work, particularly in human services and services like child welfare. It's really transformative. By co-designing with those who have lived experience, we're creating solutions that address their needs, right? Not the assumptions of the system. So arguably, when we have families at the table in the spaces, the system becomes more effective, more equitable, more inclusive of those families in the processes that are otherwise mandated. Which leads me to the third musing for today, which is this idea of policy and legislative mandates, which often, sometimes drive change. Sometimes that change is not preferred. Sometimes it's poorly designed. It's often unexpected, right? So even if it is welcome, right? Or even if it is thinking through, like, we could really think about how to do that well, it's often unexpected when it comes to kind of some of these policies and services with child welfare in particular. So thinking about that and this kind of piece specific to that when we're thinking about our work. The policy realities are that sometimes we have this do this now, right? Here's this policy, you need to make it happen. And that might be 3 days, it might be 3 months, it might be 6 months, but we know do this now is still much faster than we do research, right? So if this comes down and we know it's happening, systems have to respond. How do we respond to that also from the research lens, from our implementation lens, particularly when it's so much faster than co-design research, right? When we're thinking about those best implementation and community outcomes in this policy context. So just kind of in mind as during the course of this study, there have been numerous kind of policy changes that have really impacted the service system as we've been doing the work, right? And so how can we keep doing this work and co-design work and then kind of potentially turn this where that work is now informing the way that policy may be put into place? So I'm going to segue one more time to this idea of nothing about us without us. Our community partners actually say this, both our community providers, as well as our child and family well-being leaders and system partners. They talk very with a lot of pride about their family-centered approaches, about putting tools in place to partner and ensure family and youth voice, to have this idea that there shouldn't be a policy or a program that's created for a community without the input of that community. And the intention is really there, which is really also the center of what we know to be so much of our kind of implementation science and equity work and that lens, right? So thinking about how do we really do that by being inclusive. And then also recognizing a lot of the challenges that come with that, which will, of course, come up again through the course of this talk. So when we think about engagement and effective engagement, particularly in child welfare, this happens when social workers and their support providers actively collaborate and partner with youth and family throughout their involvement with the service system, again, with the intention of empowering. So that brings us to why we did this study. So this is funded by the National Institute of Mental Health, and that is how we got here, is that half of the youth involved with child welfare meet the criteria for at least one mental health disorder. There's an exceptional amount of need. The linkage to mental health services is part of this particular action plan for youth and families that are involved with child welfare. So the idea of involving parents and caregivers in treatment planning, as well as youth, through shared decision making is imperative and vital for their own outcomes, right? It's imperative for service linkage. And if parents and youth feel like they are involved, they're more likely to follow through. They're more likely to engage in the services. And historically, they feel like they've had limited input, right? This is well documented in the literature. So we have historic unmet need, and we also have this kind of historic lack of space for parents and youth to have their own input. So in comes the child and family team meeting intervention. This is also in the context of team decision making, team planning, family decision making. These are all types of models which really bring together youth, parents, caregivers, social workers, behavioral health providers, advocates, other support individuals to develop an action plan with clear responsibilities and goals that address placement decisions and the specific needs of the child. They're family centered and they're collaborative and they're intended to rely on these teamwork approaches, right? To really promote active engagement for children and families and giving them a real voice in their own decision making. The idea being that they're building service plans based on mutual agreement, right? So if you bring all these people together, all the folks that are involved in the youth life to collaborate, you create this strengths-based, needs-driven, culturally relevant plan. Doing this also, right, builds trust. It respects the strengths and culture of the youth. It helps professionals better understand those children's needs. And again, when you do this, they're more likely to participate in services, right? So lots of promise. It's also required in California. So the state of California requires child and family team meetings in San Diego and in our Department of Child and Family Wellbeing. Youth has to have a child and family team meeting within 60 days of being open to receiving services with the service system. And the CFT is the primary means for youth to get access to their mental health assessment. So again, why we're doing this study is because we want to improve the effectiveness for youth to get that mental health service linkage, right? So what that means is that you have great shared decision making. You have meaningful parent engagement and youth engagement. There's commonality in their goal setting, right? People are on the same page in this team to basically ensure that those youth who have need get the services they need. So that's our study goal. Our team implementation strategy is an after action review. An after action review is a very fancy name for a debrief. That's exactly what it is, right? It's a simple, quick tool intended to improve team learning and performance and effectiveness. You reflect on a specific performance episode and you engage in this process of kind of how did it go? This self-discovery process. How did that feel for me? Did it do what we thought it was going to do? These are actually developed in military setting. They're called one of the most successful organizational learning methods yet devised, yet they're one of the most simplistic, right? So they're a very straight, direct tool to improve individual and team performance. So for the folks who are my system partners, bear with us with this really cool conceptual model. This is aligned with the InStep Center. All the projects across the center have this kind of common approach to what we were thinking of when we think about inputs and strategies and mechanisms. And so this is the one specifically for our study. So we have the child and family team meeting, our team inputs, which are our member characteristics, implementation strategies. I'm going to tease this out a little bit more, but essentially we have CFTs, right, as they're designed to do. And then we have the enhanced CFT, right? So the CFT with the debrief. And then those things are intended to impact team mechanisms, which then impact our outcomes, which are, did the debrief work? Did it not work? Did they like it? Did they not like it? Did kids get service linkage? Do they have more agreement on their service plan with their families? These types of things. So we're going to apply this debrief to improve the implementation of CFTs in child welfare. We did this through three aims. The first one is conducting a qualitative needs assessment to understand the ongoing implementation of the CFT service intervention. Then we adapted and tailored the debrief to address the intervention needs. And then we pilot tested the debrief for improving CFT outcomes and exploring team mechanisms. So I'm going to talk about our aim one and our findings from our qualitative needs assessment, and then I'll pause and then I'll go through aims 2 and 3. So for our qualitative needs assessment, we had the amazing opportunity to connect with 76 individuals across 8 interviews and 8 focus groups. They represented child welfare personnel, and our department is called Department of Child and Family Wellbeing. So when I say child welfare, it's kind of representative of the whole service system. So leadership, social workers, so those folks who are boots on the ground, and the social workers supervisors who are called services supervisors. Family members, we had the opportunity to talk with both biological parents and resource caregivers. Resource caregivers are when youth are in out-of-home placement. It could be a relative caregiver, it could be what was formerly called foster living, could be a group space, but a resource caregiver is everybody in that bucket that's not the biological parent. We had focus groups with former foster youth, CFT meeting facilitators, and some of our community providers. So DSEP, the CASAs, some therapists, folks like that. So we learned a ton. And during this needs assessment, so much are really, really rich, awesome information. But kind of one of the big things that we, took away from this is that participants generally agreed on these principles that underlie CFTs, right? The benefits of CFTs. So it's not surprising though, right? These are cornerstones of child and family well-being's approach, right? They focus on preventing unnecessary out-of-home placements, connecting families with services. So people agree that the CFTs play a vital role in enhancing service coordination. So they foster collaboration, rapport, they intend to do trust building. The participants agreed the shared understanding of the family-driven goals and the intentions and the positive aspects of the CFTs in terms of their sharing of success stories. There were some really great stories. So people really overwhelmingly agree in the promise, is what we've been calling this, of the CFTs. With that being said, there were also a lot of kind of red flags that came up, things that people were concerned about, right? Or the themes that came up about areas that could be kind of seen as areas for improvement. So one of the kind of key things here is this idea of, I'm using the voices of our participants here, is, are we really in the space to get to a shared decision making, right? Are we really empowering families in the way it's intended to be? So here we have a social worker who said it's just a matter of informing the families. They're not going to agree to it. And this came up quite a bit, right? Like they might not agree, but we're all going to at least understand that that's the goal, right? So something for us to put a pin in. Does it have to be agreement as long as they understand the goal? And then a community provider says it feels like we're here to check a box and not have a conversation that's really focused on the needs of the child. And so this idea of where does this kind of promise meet the idea of compliance and just kind of going through the motions. We had 9 overall areas of improvement that we kind of highlighted. The top 3 of these are what we really think of as kind of the before the CFT or the planning phase, right? So really came up this idea of importance of advanced communication and planning, uh, effective communication before the CFT, and then establishing a process for clear purpose and goals. Why are we here? Like, have people know that in advance. And then the inclusion of a comprehensive family support network, better notification, more people at the table. Is it the people that the family want there? Who's driving the decision making? And then we also had some of these that are more about what's happening during the meeting itself, right? Making sure that there's respect and everybody's getting a space to talk, improving the understanding of the mental health assessment, which I'm actually not going to get into in depth today, but we could have a whole other conversation about that, and competent facilitation. Oops. And then this kind of after the meeting, what do we need? We need clarity with accountability. What's going to happen after I leave here, right? We learned so much about kind of the effectiveness and the engagement of CFTs really is not just about what happens in that meeting space, right? But what also happens before, what happens after with regard to that accountability and follow through. Moving beyond the checkbox, elevating the voices and strengths, and then empowering and supporting youth, which I'm going to talk about more in just a second. I'm going to make a plug for this QR code, which is a two-page brief that we created. We created a longer report for our system partners, kind of sharing back our findings. Again, a really important part of the work that we get to do, right? Is, hey, this is what we learned, making sure we're sharing it back and reflecting and kind of having an opportunity to iterate with them. But this QR code will take you to the two-pager, which kind of summarizes these in some more detail. I'm looking at everybody's scores on CFTs. Okay. All right. So just to speak to the youth piece for a minute, because one of the things that became very clear for us, and a couple of the folks on the team have done a deeper dive actually into the youth findings, is that youth really feel outside of this process. And so the four main themes that came up for youth specifically were they want their voice centered, and it's not. There's a fear of retribution. Am I going to get in trouble with my family? Right? That's kind of a big question mark. Is my social worker going to say something that I don't want them to say? Um, there's no trust for the youth. They feel like the process is pretty broken and that the gaps in the mental health service connection are real. They literally are like, what's the point of the assessment? So some of their words for us here is they want to be a part of the conversation. It's my life and my input matters. And I don't think the mental health assessment helped connect youth to mental health. For my case, I had to seek everything out myself, right? So again, using their words to kind of reiterate some of these. And one more quote to just share with you from this first AIM finding is the service system really does get it, right? When whether this is in San Diego or talking to folks outside of our county, outside of our state. One of our leaders said, I think communication is key throughout the life of the case. In order to make youth really be a part of the child and family team, it's not enough just to contact them when we need them to come to something. Maybe at least twice a month, just checking in. Hey, how's it going? Anything I need to be aware of? Just a quick check-in. And so that way, when they're in the team meetings, they feel like their input is valued, right? So this idea of really establishing a relationship and an ongoing pattern of communication is known to the service system. There's just a lot of barriers to that actually happening. So I'm going to pause and see if anybody has any questions or comments on our qualitative findings before I dive into the debrief and the pilot. Does it resonate for those? Am I representing the work well enough, I hope, for those of you who participated? Okay, you can call me out if not.
No, very, very well represented so far. So we're good.
Thanks, Greg.
Yeah, and I'm looking at the chat. I don't see any questions in the chat. So
Okay. Okay. So we learned a lot from our qual findings and our qual inquiry. So the next part of this was to adapt this after action review, the debrief. This was basically say, okay, what did we make sure we learned from our community participants around things we need to know about what could or could not go well potentially with doing a debrief with these families. A couple of the main things that we made sure we wanted to include, it had to be succinct, right? So CFT meetings, and again, there's some variability on our experience with these in this space with you all, can be really long. They can be short, which is 45 minutes to an hour. They can be up to 2.5 hours sometimes. It's usually somewhere in between there. But they're long in terms of time. They can also be super emotionally draining, right? There can be a lot going on during these meetings. So one of the things that we understood is we are adding an ask to these families and to these providers and to our system partners to stay longer, right? And help us understand what went well during that meeting, what do we need to learn. So we knew it had to be as succinct as possible while also being effective. We also made sure that we were able to do them in English and in Spanish. Um, so those are kind of the two big accessibility things. One thing I will also say is that we did not include youth in the debrief itself, right? So even if youth were in the CFT, right, even if they were participants kind of during that actual meeting itself, they did not participate in our study. And that was twofold. Initially, it was kind of county driven, partner driven, but then also after we had some conversations and did some more learning, including with the youth themselves, we really understood that it could be potentially even more harmful for them. Like, right? So it's this really interesting space, right? Like you want to give them space and make sure that there's a voice and an opportunity for them, also for the youth to be able to share, gosh, what was your experience like? But we did learn that them doing that potentially with their caregivers and their social workers in the space didn't feel like a safe or comfortable space for them to be able to do the debrief with us. So something for us to put a pin in terms of thinking about what does this work need to look like, including youth, when we think about that from the research lens, kind of moving forward. So that being said, we had 4 questions during our debrief. So debriefs can be kind of a checklist, so to speak, right? They can be longer or shorter, but really what they're intended to do is, did the CFT accomplish what it meant to, right? Did we do what we intended to accomplish? Then we try to establish the team's understanding of what happened. Um, if it did it accomplish what it was intended? What did actually happen? You explore the causes of the results and focus on 1 or 2 key issues. So I heard you say today's CFT intended to accomplish blank. Some of you think this actually happened. What do you think that was the reason for that, right? What might have helped get there? What might have been a hindering factor? Like what might have prevented us from getting to where we thought we were going to? And then you want to provide time for that child and family team to reflect on what it should learn and how to be more effective in the future. So that's what the debrief does. So after the CFT, we go through this. It's facilitated by one of the folks on our team. What should we learn? How can this process go better? The debrief could last 15 to 20 minutes on average, right? Was about where we were with our debrief. So we have this debrief, it's ready to go, and now we're going to pilot test it. So our design here is we're working in a large, diverse county child welfare system. Here we have San Diego. And so San Diego has 6 regions, and this picture depicts on some level what those regions look like. It is an extremely large county, both in terms of population and demographics, diverse, as well as geographically. I don't think a lot of people realize how huge San Diego is. It goes pretty far north and pretty far east. So the 4 regions that we included were East, South, Central, and North Central. So we did not include either of the North regions in our study. We had a stratified randomization to our intervention condition. So we had social workers within those regions, and so families were placed into either the CFT as usual or the enhanced CFT, which had the debrief condition based on their social worker. So social workers were never in both conditions, right? They were either one or the other. Our inclusion criteria were pretty direct. The youth who was open to the service system had to have an identified behavioral health need. If they did, a recruitment happened through the social workers. So if the family met the inclusion criteria, the social workers invited the parent using our recruitment materials that we had shared. If the parent said yes, they were willing to participate in our study, they then had to get a judge to approve participation. That's the youth's judge. It has to say that it's okay for that family to participate. And then the CFT members were notified. So other folks who are on that support team. So other family members, the community providers were notified that this was going to be part of the study. And then once all the approvals were met, UCSD was invited to that CFT meeting. So we attended 55 total meetings. This is great. We were aiming for 40, so we wanted to make sure we had at least 20 in each of our conditions, if you will. So we had 22 in the intervention condition, which included the debrief, and 33 in the services as usual. All of these meetings were virtual, right? So something else to be keeping in mind when we think about the meeting context. Pre-pandemic, CFTs were in person. They went fully virtual. There's some advocacy for them to be back in person. Some of them are hybrid, some of them are in person, but all of the ones that we were invited to attend were virtual. So during the meeting, we were off camera. We consented to be there into confidentiality. We observed off camera and we completed the CFT fidelity tool. And we took observation notes. And then immediately following the meeting, for those folks who were in the debrief condition, they went through the debrief and then they were invited to complete a survey. And then if you were not in the debrief condition and UCSD was there, you just had to complete the survey. So that was the difference between the two. They got the same surveys with the exception of those in the debrief condition answered questions about the debrief itself as well. We had 280 total participants across those 55 CFTs. So CFTs can have just a handful of people in them, right? It could just be the social worker and the family. It could have 12 people in them, right? 15 people. It could have the extended support network. It could have all the, family members, the CASAs. So it can be, there's a lot of diversity, if you will, in the size of the meetings as well. So we had 280 participants. The majority were female. There's our race and ethnicity breakdown. And then the role of the folks who participated in our study, 39% were the social worker. So that's the child welfare social worker. 16% were a resource parent or caregiver, and 14% were a biological parent. So 30% were one of the caregivers or two. And then the community providers were 24% with another other or missing is 7%. So kind of around a third, right? The majority from the service system, but we had about a third parents and about a third providers as well. And then the study condition just reflects kind of what we mentioned before, which is that we had a little bit more, we observed more CFTs as usual than those with the intervention. Okay, so our analysis, we did some multi-level modeling where we made sure the CFT members were nested within the CFTs with random intercepts, and we examined between condition effects on team mechanisms and services outcomes, controlling for region and the CFT member role. The big reveal, part one, our pilot test findings. Our results from our multi-level models suggest there were no significant effects of the condition on any of the variables of interest. So in layman's terms, what that means is that the debrief didn't make a difference. So whether or not participants had CFTs as usual or CFTs with our debrief at the end, they didn't feel differently per se with regard to how the team functioned or if they were satisfied with the actual process itself. We can talk a little bit more about the why of this. I don't think that knowing what we know now, we were overly surprised to find this by the end of the study that the debrief didn't have a significant impact, and that's partly because it happened after the meeting. So maybe some overtime with the debrief would be really interesting. Like if you did the debrief with the same team, multiple times, I would think you would probably see some differences there. But the touch point right afterwards was an interesting one. So the second key finding are intra-class correlations, ICCs. So again, in layman's terms, they examine the degree of similarity among the CFT members, right? So that means that no matter what your role is or kind of where your background comes from in terms of coming to the space, that you get there and you function as a team, right? So you want ICCs to be high in a team setting, right? And these are all very low. So essentially what having these really low inter-class correlation means is that these people aren't responding as a team. They're responding as individuals, right? Or people who have specified roles, right? So people felt there were very different perceptions of how that team even operated based on their role, right? And so that's something we really want to think about too, because the idea, right, if we go back to that idea of the promise of the CFT and that you really think there's this belief that CFTs are a really good thing, right? They're designed to empower the family. They're designed to create shared decision making. They're designed to kind of make sure that you have an agreed upon action plan so these families can be really successful. Um, but what we're hearing is these teams aren't actually operating as teams. Again, I don't know if that's surprising to anybody on this call, like folks who are in the field. We were like, maybe they'd be more like teams. Um, so they're not teams, but we did run some additional analyses and we did find significant differences in the team processes and outcomes by the role, right? So regardless again now of whether they're in the debrief condition or just CFT as usual. So for example, I'm just going to touch on a couple of these. The team processes differ by social workers and community providers largely, right? This was kind of, I think, one of the most interesting things to think about. So we have 3 domains here: goal specification, strategy formulation, and coordination. So for example, coordination is to what extent the CFT actively work to communicate, right, and work together. Goal specification is the identification and prioritization of specific goals and sub-goals to get to the same end. And so the bottom bar, and these colors are, the bottom bar is the child welfare social workers, and that kind of regular color blue. And then the brighter blue is the community providers. And so this is where we're seeing this large discrepancy, where across all of our outcomes, the social workers tend to have more positive perspectives on how the team worked. And the service providers actually tend to have the least positive perspectives, right? Even less so than the parents and the biological parents or the caregivers. So kind of we can see that pattern here with regard to across the board, social workers are always going to be the highest and the service provider is going to be the lowest, and somewhere in the, in between those two are the biological parents and the resource caregivers. And then, so that was across team processes. I also share this for psychological safety, which is this shared belief that your team is actually a safe place to be and share openly, and similarly with trust, the willingness to be vulnerable to the actions of another party. You see that trust pattern really shake out here again as well. So where social workers overwhelmingly perceive that yes, and the service providers are like a little more skeptical of whether or not these things are actually happening. And then one more kind of outcome that we added specifically for our project in the larger context of the center is this notion of willingness to speak up, right? So this is actually called a silence measure. And this came from too, so much of what we were learning at our qualitative was that, people didn't necessarily feel that they could, right? So we have these 2 silence domains. Acquiescent silence is this kind of disengaged behavior. Essentially, you've given up hope, right? Why am I going to bother talking? Because it's not going to make a difference anyway, right? It's not going to change anything. So that's acquiescent silence. Quiescent silence is active withholding, right? For fear that speaking up will get some sort of consequence or retaliation, right? So one is like, I have no hope, there's no point. The second one is, I want to talk, but I'm scared to talk. And here, higher numbers are actually less positive, right? So again, here you can see that the social workers generally think this is a pretty safe space. People can talk, no problem. Whereas you have your resource caregivers and your biological parents now at this upper end of this, right? Thinking like, actually, I don't necessarily feel completely safe. And while these numbers are actually still not like super high in terms of on the scale, it's literally over like twice as much about for the providers and I'm sorry, for the resource caregivers and the biological parents in terms of their comfort in speaking up. This is supported by, again, some of the open-ended kind of comments we heard. It's really hard when all the decisions are made and we don't really have a true say. We're allowing you to hear our voice, but is it really being heard? From a resource parent. I was very dismissed. It wasn't a safe place to even bring up my thoughts, opinions, and what I needed from a youth. So that's our pilot learnings and some other feedback. I will take a moment to pause again for questions, comments. Anybody want to ask about my ICCs? I'm just kidding. Before I kind of get into an overall summary.
Yeah, there's a question in the chat. Luisa, do you want to unmute and ask, or I can read it if you prefer?
Um, yeah, sure. I'm just curious who is the main facilitator or who convenes these meetings, if it's like the folks that you listed, and who develops the agenda. If that's like co-created or if someone like individually just creates it for, for the CFTs.
Yeah, that's a great question. So, um, this changed a little bit over the course of our study as well. But for the majority of for the most part, there is a contracted facilitator agency who does the facilitation of the CFT in San Diego. So our service system notifies the facilitating agency and says, okay, we're going to have a CFT for this parent. They provide the agenda to the facilitator. Then the facilitator is responsible for getting everybody to the meeting space. There's a ton of variability in how that actually happens, and how much of an agenda is actually provided in advance versus people showing up and not having had a specific agenda in advance. We receive notice for these CFTs sometimes a week in advance, sometimes 2 hours in advance. So a lot of variability. But the short answer is there is a neutral facilitator who actually holds the meeting space, and the social worker for the family is the one who coordinates.
Thanks. And I guess I was just thinking, based on the data that you provided, if the social workers were higher, because the dynamic is, I don't know if it's sponsored or funded by the county, right? Like this kind of set, the structure. I'm
Yeah, the
wondering if
social
like,
workers are county social workers.
yeah. So I'm
Yeah.
wondering if like, because they think it's like part of, their department, they're more supportive of it, or they see more value of it because there's like that relationship there, as opposed to like the providers who are kind of not necessarily in the, inside the county,
Yeah,
right? But yeah, thank you. Thanks for answering.
sure. I invite any of my amazing county providers to feel free to chime in if I, want to as well. You're going to say, Greg?
So I'm just struck by, this project from the beginning, the mismatch between the intent of the policy and what's happening in the child welfare systems. And wondered if you can talk about that, or if any of your plans going forward are seeking to kind of narrow that gap, that bridging factor between kind of outer policy and inner context of the child welfare systems.
Yeah, 100%. I think we were also struck by it. At the level at which it was, right? I think that we probably anticipated some inconsistency. But I think that we would have thought maybe the inconsistency was toward the every once in a while it didn't go how you thought it would, as opposed to every once in a while it goes as it's intended to. Um, and yes, the answer to plans for moving forward, right? I think that there are a lot of unanticipated findings with this particular study, and I think one of the main ones that to take away from it that we're grappling with a little bit, and this is why it comes to this idea of what kind of co-design work or including community in thinking about the next study and or chunking which part of this to focus on for a minute, is this idea that I lost my train of thought. That there's so much discontinuity um, with the idea that these aren't teams, right? Like these are child and family team meetings, And these meetings are mandated, right? And now they're being like there's even more new policy coming down around the idea that there's a mandated meeting that has to happen in a certain amount of time. We actually have several quotes from both system folks and community providers where they're like, the amount of time sometimes isn't enough, or sometimes it's too much. I mean, so there's a lot of these, like, right, so this is the policy mandates, this has to happen in this amount of time, and that's not family centered in from the beginning, right? And then it has to happen at this sequence, and then you have to do certain required assessments. So I do think that there are places where we have to think about chunking this or segmenting it, to thinking about bridging that gap, to speak to your question, right? Like, what can we do at the front end, right? Like, what's the strategy here? Okay, what's the strategy for the actual during the meeting? And I think that, what I would, I don't want to speak on behalf of county, but I think county would advocate that they have a lot of training and a lot of processes in place for the meeting itself, right? And for kind of creating a safe space and doing those things. But I think so much of what we're hearing is that so much of the disconnect is what happens before the meeting and what happens after the meeting too, that even creating that meeting space is not creating a team, right? Creating a space during the meeting. That's a great question, though. And so I can work through some of our key learnings and just kind of leave us with the thought questions too. Again, taking this idea that across the roles, there's consensus on the promise. Greg just teed this up, but the real world implementation is falling really short of that. This pre-meeting and meeting preparation is virtually absent. We really see opportunity here to do some meaningful work that might actually help with teams being teams or feeling like teams, right? If you're actually, to Luisa's question, if you're co-creating agendas, if you're having your family meaningfully participate in, like, here's what I need from this space, right? Or, you know what, I don't need this space right now. Can we honor that somehow, right? So thinking about how do you meaningfully include your family and youth in that. And we know that the debrief was not the right strategy in this current setting, so something for us to think about. We do also know the research literature demonstrates this, that these teaming approaches do have the best of intentions, right? For equity and engagement and all the things that we also think about in the implementation science lens, is making sure that the work that we do and the interventions develop and the way that we work in community spaces has all these really positive things, is kind of centered. And and again, the service system gets it, right? And I think this goes back to this disconnect. Here we have a leader say, I would describe a successful CFT where the family feels heard, the family or youth feel heard, they feel respected, they're part of the team, they're not walking into that meeting and the county is putting it together, right? They're not being told what's going to happen to them. A successful one would be them leaving feeling they felt supported, heard, and what they want is part of the plan, right? So how do we bridge this connect? I think we have to do it through a community engaged approach, thinking about co-designing and continuously improving the process of CFT meetings with families and communities themselves versus relying solely on agency-led perspectives and initiatives to CFT implementation, right? So I might reimagine this through a community engaged by shifting ownership from the child welfare system to families in the communities. Instead of meetings being agency driven and compliance focused, how can they be family led? How can they be community anchored? So some reflections. CFTs are important and intentional strategies for including youth and families. They're also required and essential, right? So they're important and intentional. They're required and they're essential. And we have a clear need for youth integration into them. So they're important, they're required, they don't work as intended. Where are we going to go from here? Julie.
I have one question that just came to me.
Sure.
Did any of the participants give feedback about the meeting venue being virtual opposed to in person? Asking because a meaningful CFT can look very different. And I think when you're in a room with people, there's space for big feelings and moms crying and opening up and feeling honest. And I've noticed for CFTs that happen virtually, not all of them, but cameras are off And it's really easy to not hold space or to be kind of checked out and have that barrier up for participation. So I didn't know if that came up at all.
It did come up, and we didn't ask explicitly about it, but it did. Joel, do you have any specific? I don't mean to put Joel on the spot. Joel is our like master of the qualitative inquiry, so he can probably speak specifically to what we learned. Oh, you're muted, Joel, or I can't hear you. No, but that's okay. You know what, Julie? I think what I should do actually is poll that specifically and see what we have that specifically. So we didn't ask that intentional question, but we did hear a lot about the engagement and the cameras off. And a lot of it happened to be too, like we'd have like a social worker calling in a parent on the phone. I mean, so there was just a lot of that, right? So what we did hear too is there's that blend of like, there's definitely people who are like, it's easier on my schedule, right? But we kind of know that that doesn't match to the effectiveness of it. And unfortunately, we don't have, a study from 6 years ago where we can say, hey, look at, we weren't having this massive disconnect when we were able to do more of these in person.
Thank you.
Yeah, Elizabeth.
Hi, Danielle. And this
Good
is
to see
just
you.
such a cool study. I'm really excited to hear about it. I think just one of the things that really strikes me is like the idea that you can do coordination in a meeting, right? Like, okay, we'll have this one meeting, we'll just figure it all out, and like that will just solve the problem, right? And I'm curious if any of these groups repeat this meeting. Like, what
Mm,
type of other coordination and team meetings are there before and after? Because that just seems so critical. I'm thinking about like the role of debriefing too, right? It's kind of
yeah.
relevant if the team works together again.
Yeah, great question. So this is also like, learn, build the airplane while you're flying the airplane, one of those metaphors. Um, that yes, there are overtime meetings for families who stay open to the service system. They're required to continue to do them at 6 months and then other reasons. And again, I'm sure that the folks who are community members or community partners in the space could speak better to that. And our original intention with the design was actually to follow families within social workers, right? So you have a social worker and, I'm the client, and now you might come to my meeting 5 times, and you're either in the debrief condition, and we might see if there's an improvement in the team dynamic versus not. For a
Mhm.
variety of reasons, that did not happen. But we also very much learned that this is a great point about the team, right? What we very much learned is what we are studying in San Diego and what we are partnering with in San Diego right now is the meeting, right? So are these two different things? And that's actually something like, are these two entirely different things? Like, is our strategy actually not about the meeting at all, but about who does the team, how does a team need to support that's because not everybody even shows up, not everybody gets noticed, and sometimes the team members flux and they come and they go. So yes, the family has these meetings over time, but my impression is it's not the same people in that space every time.
Yeah, that brings back a very clear memory of me for a family, child welfare family, where we were having these weekly team meetings that I was facilitating. And then at one point they're like, oh, and we had our meeting last week. And I was like, oh, they had their, child and family team meeting with child welfare and we weren't invited, even though
Yeah.
we were meeting weekly about this case.
Yeah.
Yeah, definitely a challenge.
I, Yeah, so I see people in the chat, which is awesome. I know that we're right up against the 3 o'clock time. I'm happy to continue this conversation. I would love and welcome anybody who wants to strategize about where we can potentially think about the key intervention moments, because we are going to continue to do this work. There's new policy in the state as well that's kind of impacting how we're thinking about doing this work. That is my email address on the screen. This other QR code will take you to our protocol paper for the actual study. We'll tell you, it basically will summarize in even more academic terms what we did during the study. And then we have a couple more things that are underway at the moment. But thank you for inviting me to this space, Marissa and all, and thank you everybody for being here. Super grateful, and again, I'd love to continue the discussion.
Thank you so much, Danielle.
Thank you.